Hello, I'm Dr. Sandra Fryhofer. Welcome to Medicine Matters. Today's topic, a new health alert from the CDC raising concerns about limited supplies of rabies vaccine. If current trends are not reversed, we may have a shortage. Here's why it matters. Rabies is deadly. Without treatment, rabies is almost always fatal for humans. That's why pre- and post-exposure prophylaxis are so important. Worldwide, 10 to 12 million people receive rabies vaccine each year, including as many as 40,000 people in the United States. But now, rabies experts say disaster could be just around the corner. An unprecedented chain of events has created a near-perfect storm. Increased seasonal juvenile bat activity, more rabies exposures, and increased demand for rabies vaccine at a time when backup supplies are low. That's because one of the two vaccine makers, Sanofi, had to stop vaccine production temporarily while renovating their lab. So the pressure's on Novartis, the only company left making rabies vaccine, to keep up with demand. And that may not be possible. The concern is if demand for vaccine keeps growing at its current rate, existing supplies could run out. And that's why the CDC has issued an alert urging judicious and appropriate use of rabies vaccine. And that's where doctors and other healthcare professionals can help. The CDC says that not everyone who gets the vaccine actually needs it. Existing supplies of vaccine should only be given when needed and necessary, and every dose is precious. At more than $4,200 for the rabies vaccine series, it's also expensive. Obviously, fear of rabies is rational and appropriate. But after rabies exposure, treatment does not have to be given right away. There's still time to clinically observe and test the animal to see if it's rabid. Anyone bitten by a possibly infected dog, cat, ferret, or any other animal should try to locate and contain the animal. In the United States, if the animal seems healthy, it should be confined and observed for 10 days. If it stays healthy, you're probably in the clear and won't need the shot. But if the animal sickens or dies, it has to be tested immediately. If it tests positive, you need the rabies vaccine series. But if the animal cannot be located, captured, and observed, try to find out if it showed clinical signs of rabies. Bat bites are in a category all their own. Bat bites are considered rabies exposures until proven otherwise. And unless the biting bat can be confined and tested, which may be virtually impossible, you must assume it has rabies and get the rabies vaccine series. Now more than ever, the CDC says it's important to avoid rabies exposure by taking appropriate precautions. Vaccinate all pets and livestock that have close human contact, and avoid stray and wild animals. If you are bitten, immediately clean the wound using soap and water or use a dilute iodine solution. This may help reduce the likelihood of rabies transmission. Make sure you're up to date on your tetanus shot and see a healthcare professional as soon as possible. Also, try to capture or detain the animal if you can do it safely. Given the current vaccine shortage, checks and balances have been put into place. Novartis, maker of Rabies, the only vaccine currently available, now requires a confirmation code from the state health department before releasing doses of rabies vaccine. Specifically, information about the incident will be required to confirm there was indeed a sufficient level of exposure to warrant vaccination. Sanofi says it plans to resume vaccine production in late September or early October. It is hoped that will be soon enough. For the full report and details, as well as the latest updates about rabies vaccine supplies, check out the CDC website at cdc.gov. For Medicine Matters, I'm Dr. Sandra Fryhofer.